How much should you walk after a total knee replacement surgery? How much do you need to walk in order to recover? And can you walk so much that you end up slowing down your progress? The short answer to how much should you walk after a total knee replacement is as much as possible, given 3 caveats. Number 1, that it can't worsen your swelling. Number 2, it shouldn't worsen your pain. And number 3, you can't limp. Now, let me clarify number 1 and 2 by saying that worsen means dramatically worsen the status. If you've been icing and elevating your leg like you should after a knee replacement surgery, and then you put it down to walk on it, it's normal for your knee to swell. But then after you ice it and elevate it again, it should return down to the same baseline. Now, icing and elevating is extremely important after total knee replacement, and within the first month, you should really be doing that at least 3 times a day for 20 minutes. But if you put your leg down and you go to walk and it dramatically balloons up and then it doesn't come back down, you've probably walked for too long. So get back to icing and elevating and then back off your time or your distance until you can walk that same time and distance without worsening your swelling. That is not just a small temporary increase, but a long-term or dramatic increase in your swelling. Now, number 2 with pain is the same. After you've had a major surgery like a total knee replacement, it's normal to have some pain when you go to load the tissues that have recently been operated on, but that pain should go back down to a baseline level shortly after you've stopped exercising. If you exercise and your pain increases a little bit and then you sit back down, that's just fine. But if you get up and you walk for say 5 minutes or 10 minutes and then your pain is worse for an hour after doing that, you probably need to back off the time or back off the intensity a little bit. And by intensity, I mean how much weight bearing you're putting on it. Using a wheeled walker or a cane can allow you to walk for longer periods of time without increasing your pain as much. Now, number 3 is that you shouldn't limp. And you can walk for longer periods of time, but if your muscles start tiring out and you start limping, or you start developing so much pain that you have to limp, you're probably not doing yourself any good. In fact, I think one of the biggest disservices that physical therapists do for their patients by accident is progressing them from a wheeled walker to a cane to no device too quickly. And the reason for that is that if you're progressing from a walker but not able to walk as long, then you haven't really progressed. Think about it like you're lifting weights. If you can lift a 5-pound weight and do that for 10 repetitions, and then you increase the weight to 10 pounds, but you can only do it for 5 repetitions, have you really progressed? All you're doing in that sense is exchanging volume for weight. And the same thing applies when you progress from a walker to a cane to walking with full body weight. You're walking with roughly 50% body weight, and then 80% body weight, and then 100% body weight when you're walking without a device. But if that makes you walk for shorter periods of time because your knee hurts too much, or if it causes you to limp, that can end up creating other problems down the road. I can't tell you how many times I've seen people who, months or years after they've had a knee replacement, end up developing hip pain or back pain because their knee stopped hurting, but they have a persistent limp that they'd learned as their new subconscious gait pattern. And even after the pain goes away and pain no longer limits you from walking, you may still walk with that limp because you've learned that as a new habit. You'd be much better off using a cane for a longer period of time, even if that means an additional month or 2 on the cane, than to get off the cane too quickly and limp because you're having too much pain or your muscles haven't gotten strong enough yet, and then end up causing hip pain or back pain down the road. Now, there are 3 really common limping patterns that happen after a total knee replacement, and you can learn what those are and how to fix them in this video up here. But before you go check that out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.